Assalamualaikum everyone. Today we are going to study depressive disorder, and in depressive disorder we will be covering 9 major types of depressive disorder. But again, like all other disorder, our key focus will be on first 4 major categories. The rest of the types will be discussed slightly, or maybe only we shall be discussing the key difference between all other 5 disorders. So, if we talk about the types of depressive disorder, so they are somehow similar, but their duration, timing, and presumed etiology is different, which make them a different disorder. And there are some different specifier and differential diagnosis associated with it. So we will be covering all that in details. So let's start with the first disorder, which is disruptive mood dysregulation disorder. So in disruptive mood dysregulation disorder, there are severe recurrent temper outbursts. Either a person manifest verbal rages, or sometime maybe non-verbal. In verbal rages, he may be using some abusive words or very hurtful statements. On the other hand, in non-verbal behavior, he will be so much destructive, or maybe showing physical aggression towards people and towards property. So this would be the first criteria or first symptom of a person suffering from disruptive mood dysregulation disorder. Apart from that, you will see the inconsistencies in behavior with a developmental level. For example, if a person must not be in such an age where he can show verbal or even non-verbal aggression towards other people, like he or she will be too young to manifest property damages or human harm, physical or even verbal harm. So there were significant developmental discrepancies between the behavior and development age, and their behavior must be prevalent for 3 or more times a week. Less than 3 times if he is showing any verbal and non-verbal aggression, so he will not be diagnosed as a disruptive mood dysregulation disorder. Furthermore, his behavior must be persistently irritable or angry most of the day, nearly every day, and which is very much observable by others. Like other people will clearly observe that something is wrong, is happening with that person, and he is not fine at all. So the duration must be 12 months, and there must be consecutive episode in last 3 months. Only then we can diagnose a person with depressive mood dysregulation disorder. Apart from this, criterion A, which is severe recurrent outburst, and criterion D, like persistent irritable or angry mood most of the day, nearly every day, and observable by others, should be present in at least two of these settings. Either it is at home, school, with peers, or any other significant setting. So it is not it means that if the recurrent outbursts are only happening in the home and not in the school, so we cannot diagnose a person with disruptive mood dysregulation disorder. Similarly, if the outbursts are happening in playground but not in home and school, so again we cannot give them diagnosis. So the behavior must be prevalent in two settings, then we can identify, or we can give the diagnosis a person that he is suffering from DMDD. Apart from this, if a person is showing severe recurrent outburst before age of 6, or even after age 18, so in both situations he cannot be diagnosed with DMDD, because the person who is younger than 6 years or older than 6 years, in both categories the criteria doesn't fulfill. Furthermore, we can give the diagnosis before age 10 years. There must be a history of observation and the age onset of criteria A and E. What is E? That he must be showing outbursts in two settings. It must be diagnosed before age of 10 years. But if you are diagnosing it after 10 years, so it will be least preferable to give the diagnosis of DMDD. Apart from this, there has never been a distinct period lasting more than 1 day. Like, if I explain this, so there has never been a distinct period lasting more than 1 day during which the full symptom criteria, expect duration for a manic or hypomanic, have been met. It simply means that the full symptom criteria must be met, 3 times a week, and there must be 1 day in which full criteria must be, shown. Furthermore, there must not be, the symptom must not be appearing due to major depressive and other mental health condition. You have seen the diagnostic criteria point J and K. These are common in all other disorders. Like, the symptom must not be due to any other mental health condition, any mental health disorder, or even not due to any medication. So which is very simple. We can only give diagnostic criteria if all the symptoms are met, but if he is using any medication, so the criteria would not be that appropriate to give. If we talk about differential diagnosis, so again, because in bipolar disorder a person suffers from mania, hypomania, major depressive disorder, or even only major depressive disorder, so we cannot give them the diagnosis of MDD, because in bipolar there are mania and hypomania involved, uh, but in disruptive mood dysregulation disorder, there is no manic episode. Oppositional deviance disorder is also a destruction oriented disorder in which a person harm others, but in oppositional deviance disorder there are key differences which have not been mentioned in disruptive mood dysregulation disorder, so we cannot give diagnosis oppositional deviance disorder. Apart from this, attention deficit, major depressive, anxiety, and autism spectrum disorder also have some symptoms of disruptive mood dysregulation disorder. But again, you need to identify that these disorder had other symptom criteria which I have mentioned earlier in other diagnostic features, that these are clearly different from one another, and we cannot merge all this symptomatology. Apart from this, intermittent explosive disorder is also having some symptom, but you need to clarify criteria, especially C, D, and E, that these are different from intermittent explosive disorder. The next disorder is major depressive disorder, and in major depressive disorder, the criteria is very simple, and somehow it overlap with some other disorder which I'll be discussing later. But for now, let's discuss the key symptomatology or key criteria of major depressive disorder. So first of all, 5 or more of the following symptoms must be present during that same 2-week period and present a change from previous functioning. And in 2 areas of functioning must be changed. For example, the first one is depressed mood, and the second one is loss of interest in playable activity. If we talk about depressed mood, so again 5 symptoms must be there, and the 5 symptoms could be depressed mood most of the day, maybe every day, and maybe every day he feels sad, unhappy, empty, hopeless, so maybe sometimes tearful too. And in children and adolescents it can be irritable mood too. So but most of the time depressed mood shows like the person must be empty, sad, unhappy, irritable, and hopeless. Apart from this depressed mood, there must be a markedly diminished interest of player in all activities. Maybe whatever he or she is doing, he do not enjoy that activity. The third symptom which can be prevalent is significant weight loss. You will be observing the person is suffering from weight loss, and weight is decreasing day by day, and their appetite is also decreasing day by day. Apart from weight problem, there must be significant sign of insomnia or even hypersomnia. Either they will sleep less or maybe more. Sometimes psychomotor agitation can also be seen. For example, they must be, doing their activity very rapidly, and they will be looking so much restless and down. So these will be the evident feature. Apart from this, fatigue and loss of energy will also be very evident, and sometimes they will be showing that they feel themselves worthless, and they are suffering from some kind of guilt, and sometimes they diminish the ability to think or concentrate, and they cannot take right decisions sometimes. Apart from this, they must be having some recurrent thoughts. So these recurrent thoughts also indicates their symptom of depressed mood and loss of interest. So among these 9 symptoms, they must manifest at least 5 symptoms. So you can diagnose a person with MDD. Apart from this, there will be a significant distress or impairment. You will clearly see that their functioning in social, occupational, academic and personal domain will be lower than the other. They cannot take care of themselves, they cannot go perform well in work setting or even academically. So these will be very significant symptoms. Apart from this, at least one major depressive episode is not better explained by schizoaffective disorder. Again, it should not be due to any other mental health issues, any other mental health disorder, but it should be based on only its own criteria, or there has never been manic or hypomanic episode. When we talk about major depressive disorder, so manic or hypomanic disorders are not a part of such diseases at all. In major depressive disorder, there are some specifiers, like you need to specify according to DSM-5-TR. Either major depressive disorder is occurring with anxious distress, like he has some anxiety problem too. If he has mixed feature, like apart from MDD, he is having some other symptom which are having rapid cycling. If apart from depression, he has melancholic features, atypical feature means some representative symptoms are not there. Then again, you need to identify if there are mood congruent psychotic features, like if their mood is too angry, so they feel some hallucinations or delusion, or without mood disturbances, they feel psychotic symptoms. If their behavior is bizarre, catatonia, if it is due to peripartum onset only during pregnancy, or due to seasonal pattern, they are suffering from major depressive disorder, you need to specify all that. There are some diagnostic criteria also, differential diagnosis are also associated with major depressive. Like again, as I have said, if there are manic episodes, again with the major depressive, so you cannot give the diagnosis of major depression. If there is a bipolar 1 and bipolar 2, so again you cannot diagnose a person with major depressive disorder, because in bipolar 2 there is hypomanic episode. In bipolar there is manic episode, so you cannot get the diagnosis. Depressive disorder due to another medical condition and due to other mental health issue, both points we have discussed several times, that in both circumstances we cannot give a person the diagnosis. Then it is persistent depressive disorder, and in persistent depressive disorder a person persistently experience some depressive symptom, but it doesn't fulfill the criteria of major depressive disorder. But if it happens, so you need to make the key differences. Apart from this, menstrual dysphoric disorder, disruptive mood dysregulation, schizoaffective, ADHD, adjustment, bereavement, and sadness, all these are separate symptoms. If these are happening in a person and you are confused if it is an MDD or a different symptom, so you need to keep your key focus on the diagnostic criteria oriented points, so you will be clarify how it is not how it different from the other one. The next disorder is persistent depressive disorder. And in persistent depressive disorder, again the disorder represents a consolidation of DSM-4 defined chronic major depressive and dysthymic episode. Particularly in this disorder, depressive mood remains most of the day for more days than not, and it is indicated by either subjective account or maybe by observation of other people, but at least for 2 years. For 2 years, the duration you can see the very much long compared to other disorder, and for children and adolescents, mood can be irritable and the duration can be for 1 year. So as I mentioned earlier that depressed mood should be there for 2 years, so there must be more than two symptom with the prevalence of 2 year, and the symptom could be presence while depressed of two or more of the following: poor appetite or overeating. You can see either he is eating much more or maybe he is eating less, maybe he is sleeping so much or maybe his sleep has decreased to the normal extent. Maybe he experienced lack of energy or fatigue, maybe his self-esteem is so low, he has poor concentration or difficulty making decision. Sometimes you can see the feeling of hopelessness. So among all these six symptoms, there must be two symptoms prevalent when you are giving the diagnosis. So during these 2 year period and 1 year in adolescence, the disturbances must be without the symptom in criterion A and B for more than 2 months a time. Like this symptom must not be absent for 2 months. If a person having the symptom for 8 months, but 9, 10th and 11th month he hasn't experienced any persistent depressive, so you cannot diagnose him. The 2 month gap is not acceptable for giving the diagnosis of persistent depressive disorder. Apart from this, the criteria must not be having a manic or hypomanic episode. In all types of depressive episode, there should not be manic or hypomanic episode. Furthermore, again, like major depressive disorder, there must not be any other mental health disorder which will be co-occurring with it or maybe explaining its criteria, and the symptom must not be due to any other medical condition, substance or medication induced. So then we can say a person is suffering from major depressive disorder. As far as the specifiers and differential diagnosis are concerned, so again, you need not to learn it by rote, but you can open your DSM-5-TR and check the codes and give the specifiers. Like if it is again with anxious distress or without anxious distress, if all the representative symptoms are there or not. Is it partial remission, like few symptoms have disappeared and few symptoms are there, or in full remission all the symptoms have gone? As early, what is the early onset and was at a late onset? As I told earlier, that if it happens before 10 years, that's fine, but before 6 years and after 18 years, the diagnosis cannot be considered a fully, a full diagnosis. So again, you need to specify if it is happening with other depressive symptoms like dysthymic, persistent, major, intermittent, and how, if it is happening in with the symptom of these all disorders, so you need to give them some codes which are mentioned in DSM-5-TR or even ICD-10. Now let's talk about differential diagnosis. So again, because we are talking about depressive disorder, so all depressive disorder have some key symptom which overlap, so you need to make a key difference. Like if you talk about major depressive disorder, the duration of major depressive disorder is low than persistent depressive disorder. Other specified disorder in which reasons are not mentioned: bipolar 1 and 2 disorder, there are manic episodes; cyclothymic disorder, the duration is too long; psychotic disorder, there must be delusions and hallucination; depressive or bipolar disorder, again it will be showing that it is due to another medical condition or maybe another mental health issues or maybe personality disorder. So because in personality disorder there are some destructive behavior as well which can be a sign of depressive disorder. So you need to be very careful that your disorder, which is persistent depressive disorder, is different from all these disorders. And how? Okay, next one is premenstrual dysphoric disorder, and in this disorder the majority of menstrual cycle, at least 5 symptoms must be present in final week before the onset of menses, start to improve within a day after the onset of menses, and before onset at least 5 symptoms must be there, and once you have in your post menses, so the symptom must be absent. So the 5 symptoms which must be present are marked affective liability, like you must be having mood swing, feeling suddenly sad or tearful, or you are so sensitive to rejection. If somebody rejects, so you feel unusual pain which you don't feel in your post menses duration. And there must be marked irritability or anger in interpersonal conflicts, like your relationship becomes very weak because the way you behave and the way you react is a bit unusual. Then third symptom is marked depressed mood, feeling of hopelessness or self-deprecating thoughts, like you do not feel hopeless, you do not feel happy. And fourth symptom is there is a marked anxiety, tension, and feeling of being keyed up to the edges, and you don't find yourself, you don't pull yourself out of stress. So among these, few symptoms must be there to meet the diagnostic criteria of premenstrual dysphoric disorder. Apart from this, one or more symptom, the criteria C tells us one or more symptom must be there. For example, you lost interest in usual activity, maybe at work, school, with friends, and your hobbies also, you don't enjoy your hobbies, and there is a subjective difficulty in concentration in your work, play, in your relation, anything you are doing, you lost your concentration. Most of the time you feel lethargic and you easily get fatigued and feel you have lack of energy, and you also experience a lot of change in your appetite. Maybe you overeat or maybe you don't eat but experience craving constantly. Again, hypersomnia and insomnia must be there. A sense of being overwhelmed and out of control most of the time, and there must be a physical symptom which will be, very uncomfortable. For example, joint muscle problem, for you are feeling you are having swellings, or maybe breast tenderness. So these kind of symptoms are also a part of premenstrual dysphoric disorder. One symptom must be present while giving the diagnosis of the PDD. Apart from this, there must be clinical significant distress or impairment in many area: occupational, social, academic, personal, and it should not be due to another medical condition. And the daily rating during last two symptom cycle must be taken. For example, you must be, confirm that the symptoms are increasing in premenstrual duration, and it is not attributable to any psychological symptomatology or any other mental health issues. Okay, so these were the four disorders which we studied in detail, and now let's talk about the differential diagnosis. So you need to make it clear that it is different from premenstrual syndrome, dysmenorrhea, bipolar, major depressive, use of hormonal treatment, and medical condition, because all these disorders have some set of symptoms but not all the symptoms of PDD. Once you are very much clear with the PDD symptoms, so you won't get confused in all of these because they have minor symptoms of PDD. Okay, now we shall be covering the rest of the depressive disorder, very briefly, because it doesn't. They are not as prevalent as the four types, because if depressive disorder is occurring due to any substance and medication induced disorder, all the criteria will be same like depressive disorder, but there will be a clear history that the person is using any medication, and due to this medication he suffers from depressive symptoms. And again, if there is another condition, there must be a proper history that the person is suffering from another medical condition, or even it could be physical disorder or even a mental health disorder, and in both circumstances the person is suffering from depressive disorder, but it is not clearly a depressive disorder, but it is a consequence of another medical condition. So we can give these other depressive disorder oriented diagnosis. There are other specified and unspecified depressive disorder, like they fulfill the criteria of depressive disorder, and there must be something lacking. Therefore, the clinician provides some reason that the disorder is not a clear depressive disorder, but we can diagnose it as other specified disorder. And in unspecified disorder, again few symptoms are lacking, but the clinician do not provide any reason, and therefore give the diagnosis of unspecified depressive disorder. There are some unspecified mood disorder. There are some people who fulfill the criteria of mood disorder, but again the clinician are unable to provide any specific reason, so they give the diagnosis of mood disorder, unspecified mood disorder. So students, these were the depressive disorder, and I tried to cover it in a very brief time period, and I tried to cover all the points. But still, if you are having any confusion and is there any ambiguity, so you can ask your question. Thank you so much.